In oncology specifically, where care is complex, AI can really synthesize large volumes of clinical information, flag risks such as treatment complications, and support adherence to evidence-based pathways. For nurses specifically, this enables them more time for direct patient care, clinical judgment, and care coordination, and really practice to the top of their license while reducing repetitive time and administrative tasks.
You're listening to the ONS Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Hello and welcome to the ONS Podcast. I'm your host, Jamie Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Jen Frith, Associate Vice President of Clinical Operations at Duke Cancer Institute in Durham, North Carolina, and Emily Norboge, Director of Clinical and Research Informatics, also at Duke Cancer Institute, about how AI can help healthcare organizations improve the cancer experience. This episode provides free NCPD contact hours. To receive credit, please review the episode notes for any guest disclosures before listening. Following the episode, complete the evaluation linked in the episode notes. Welcome, and thanks for joining us today, Jen and Emily.
Thank you.
It's great to be here. So, Jen, we'll start with you. Can you briefly discuss the role of AI in healthcare and just help explain how nurses can leverage it to practice at the top of their scope?
AI in healthcare serves as a clinical and operational support tool that enhances decision-making, streamlines workflows, and reduces cognitive burden. In oncology specifically, where care is complex, there's a lot of data intensive. AI can really synthesize large volumes of clinical information, flag risks such as treatment complications, and support adherence to evidence-based pathways. For nurses specifically, this enables them more time for direct patient care, clinical judgment, and care coordination, and really practice to the top of their license while reducing repetitive time and administrative tasks.
And Emily, what were some of the specific administrative or more time-consuming tasks that you identified that AI could help with to improve the nursing workflows?
I'll start off by saying that there are significant opportunities to apply AI to reduce administrative burden on our providers. And these are just a few that we've started to work on in our clinics, but are absolutely not all inclusive of every space. So assisting with patients with medical paperwork comes to mind as like one of the easiest, simplest ones to start, where you might have a nurse who's currently helping patients to fill out FMLA paperwork or other types of administrative tasks that can sometimes fall on nursing. And an agent is the perfect type of tool to help walk a patient through that and help them fill those types of things out. There's also lots of applications of ambient AI for both provider, clinician, and nursing documentation. So we are currently using ambient AI in our clinics, where you have an agent that is listening to a recorded conversation between the patient and the provider. And then after that conversation, the agent creates all of the documentation and notes on behalf of the nurse or the provider. And that then goes into the medical record. It is always with the human in the loop. So it just doesn't go automatically into the medical record for documentation, but that clinician needs to review and approve what the AI wrote. And then an area that we're starting to look into but haven't applied yet is using AI to supplement with patient teaching and asking basic questions that, if you think about in the pre-AI paradigm, where you might give a patient a document that is, here's all the information that you should know about your treatment. We absolutely see a future where you still give the patient that document, but you can also build an agent on top of that document, and the patient could ask questions and the agent could answer those questions clearly for that patient in alignment with the document.
It's really exciting to think of all these different opportunities, as you said, this, just some of the ways it can work in some of the spaces that nurses are practicing. And I think my clinical experience was primarily in the outpatient space, in the clinic space. And so you're absolutely right. There's a layer and an element of administrative tasks that we can argue it's below the scope maybe of nursing practice, but like the work has to get done. So nurses do it. And so, so finding these opportunities to, save some of that cognitive load for nurses so that they can focus on the things that truly do speak to their level of education and their expertise sounds like a great win for everybody involved. Now, Emily, your team created a voice AI agent to help streamline some of the nursing workflows. Can you discuss a little bit more about how your team created this and just explain how it can be used?
We worked with a vendor, Ellipsis Health, to create a voice agent that is currently in a pilot with our patients in the cancer clinic. So the way it works is the agent answers the phone. This is the line that every patient on active treatment gets. And the agent will ask the patient what they need. It has a series of workflows that it can execute. It really drawing upon some of those use cases that I was previously mentioning. So if a patient needs help with medical paperwork, the agent will walk the patient on how to do that paperwork. If a patient has a question that they need sent to their provider, it can document that and then send a message to the provider. There's a series of workflows, so it can route to scheduling, it can answer information about test results that is compliant with our policy around test results. The goal of that agent is that it will handle all of those administrative type tasks that don't necessarily require a nurse to fill. And if the patient says, I need help with the symptom that I'm experiencing, then it will transfer the call to the nurse with the goal that our triage nursing team is only answering true symptom management calls, and the agent is taking all of those administrative tasks off of the nurse and effectively and more efficiently helping a patient handle those issues that still need to be handled without having to bother a nurse to do it.
Now, Jen, how has this project been implemented into practice? And what are the results that you've seen so far regarding changes or improvements to the workflow for nurses or for the patient experience?
Well, in the development phase, we did a lot of pilot testing. We had to look at our protocols. We engaged key stakeholders, our CNSs, our operations directors, and then the team just socializing the idea and what the end goal, as Emily mentioned, for our patients. Of course, change is always unsettling at times and lots of questions, but we've continued to work through this for many, many months. And the feedback so far from our triage nurses is they are really seeing the benefit. I think it's giving a lot of guidance in how to even elevate their practice and scope in triaging because they can listen, etc. So far, we don't have any concrete results, I would say, to share right now. We're still in that collection data phase and doing any PDA on any of our workflows and things. But so far, it has had a lot of positive feedback from the triage nurses.
Well, that's really exciting to hear. I certainly hear and echo that there are concerns sometimes about not only just change in general and the kind of socializing a new change in practice, but I think the change of practice related to implementing AI certainly gives everyone a various feelings that they have about that. And so I think it sounds like you are working through this implementation and taking those feedback and feelings into consideration as you continue to roll this out. So it sounds like an exciting time for your nurses and the experiences that they're having and how it's changing their practice for the better. What are some of the key challenges that you might be experiencing both before and after this AI implementation, and how are you overcoming them?
I can go ahead and just kind of partner off what I was just discussing. I think initially it was, staff skepticism and change resistance and really just concerns about loss of clinical autonomy and trusting the AI recommendations or fear of increased workload. It was a lot of work up front too for the team. And I think just to overcome the challenges altogether, it was really about early stakeholder engagement. So your frontline nurses, your leaders, Emily, our CNSs, everybody coming together and working towards this end goal. And then just transparent communication on AI. It's a decision support tool. It's not a replacement of the nurses. And that's always been the concern. Is this going to take over my job? And it's not. And inclusion of nurses in the tool design, testing, and the validation phase, I think is really important and has been helpful in overcoming some of the challenges. And again, we're a couple months in and there's now starting to have a lot more positive feedback and a lot of engagement around this.
In that design phase, which took the longest, you can set up an AI agent and have it working in 30 minutes, and it probably won't work well. The majority of our time spent in the build was actually outlining our workflows. And if a patient says this, what do we want it to say? And really understanding the process we wanted the agent to take a patient through. What we learned really quickly is that what an AI agent could technically do may or may not be something that you actually want it to do. You could ask an agent to diagnose a patient, but we absolutely never want that. And so, and I'll give you a really specific scenario that we had to go through and think about and test really significantly to get to what I think is a much better workflow than our current state. So we often have patients calling the triage line asking for information on their test results. In the cancer setting, patients have scans often. They drive a lot of anxiety. Within the scope of practice, the only individual who should be talking and discussing test results with a patient is their provider. And so today, pre-AI, when you call the nurse triage line, the nurse will have to say, I understand you want your test results. I can contact your provider and have them reach out to you about your results. But that's kind of where it ends. And what we worked out with the agent is if a patient calls and says, I really want my test results, they will, in a very nice, standard way, say something similar. I'm not authorized to discuss your test results with you, but I'd be happy to send a message to your provider and ask them to call you. But then the agent goes one step further and says, are you experiencing anxiety about your test results? If so, I can transfer you to the nurse to discuss support for a potential referral to family medical therapy if you would like help managing that anxiety. So, in a clear, helpful way, can define and help a patient with their needs and not just have a standard of this is our policy and I can't share it with you. And that took us a lot of back and forth, a lot of testing. I think the first version of the agent, it just said, I'm not authorized to send these results to, or to discuss the results with you. And I can contact your provider. And when we tested it, that felt like we were leaving the patient hanging. And through a standard process now, we've taken the AI a step further and made sure that there's an opportunity for that patient to address their needs if anxiety is one of them. It's a good example where you have to be extremely thoughtful in design of that workflow and making sure that what you're delivering to the patient is an improvement upon what happens today.
And in that example you shared, if you've already taken layers of administrative burden off of those triage nurses, they are likely more able to have the time to then get that call that's transferred to them to talk through the anxiety. And again, using their skills as nurses to discuss patients and their symptoms with them. And so it sort of kind of feeds into itself of like you're alleviating the burden for things that nurses don't necessarily have to be involved in doing, which opens them up to be able to have the capacity to be more involved in these things that do require their attention, but also that the AI can help facilitate getting them the right referral or patching them into the right services. And so you've given a great example of how this really is trying to rebalance who is doing what work. And the patient doesn't know who does what work, and they don't need to know maybe. They just want to be able to call their office and say, I need help with this, help me. And so you've given some great examples of how this agent has been sort of designed to kind of do that work of who's the right person, let's get that person involved. So I really love those examples you shared. So Jen, how can healthcare professionals be involved kind of in some of this early front-loaded work to ensure that accuracy, safety, and equity when using AI tools such as these are part of the process?
Ensuring safe and equitable AI, I think, requires really a layered approach. AI tools must be validated against diverse patient populations and then align with the clinical standards. Nurses must maintain clinical oversight. As we've discussed, AI should not replace professional judgment. There also needs to be organizations, I would say, need governance structures to monitor outcomes, identify any biases, and ensure transparency. And lastly, I would say ongoing education to help the nurses critically evaluate AI-generated recommendations. reinforcing accountability and the patient-centered care. So that's how I can see the healthcare professionals ensuring that accuracy and safety and equality when using AI.
General sentiment and even patient perceptions of AI can vary. And I think especially as these tools are becoming more prevalent in all areas of healthcare, patients are, I think, forming those perceptions and those opinions quickly. And so how can healthcare professionals help to educate our patients about what these tools are and how we're using them? How do we provide reassurance, especially if our patients are actively using and engaging with these AI tools?
We've met with our nurses and leaders, and really transparency is the key. The patient should understand that AI is used more as an enhancement, not to replace the human connection. That's not the goal. The nurses can explain that the tools will help ensure maybe accuracy, timeliness, and safety while allowing more time for the direct interaction of the nurse. I think framing AI as an additional layer of support rather than the decision maker helps build trust. And I think maintaining strong communication and presence at the bedside just reinforces that care remains fundamentally human versus AI generated.
We've learned about patient perception through this triage project. We are currently piloting the triage agent. And so our current processes are still live. The previous line where you get the call tree still exists, but patients are given the option to call into the agent and use the agent. What's been really interesting is the huge volume of patient calls that we're getting choosing to use the agent. Some patients are just calling to chat with it with no reason, but they're just intrigued. I think we have this perception that patients are going to be against AI, and especially in the healthcare setting, they want their doctor. And I think we need to flip our own biases and understand that patients need their needs met and they want them met efficiently. And when you're dealing with something as stressful as a cancer treatment, if that means using an agent to get things done, that's what they'll want to do.
AI tools of various sorts are everywhere on all parts of our lives, whether we want them there or not. And so I think we are getting that experience and exposure in what it is to use those tools and how it is different from some of maybe the clunkier earlier iterations. Like you mentioned, like the call tree, that's not, of course, AI, but that's very dissatisfying to have to go through a call tree. And so if they do give this new AI agent a chance and they realize that it is a little bit more intuitive, it's more fluid, it's, less awkward hold music. I think that these are the experiences that we're seeing throughout the world that we're living in of how AI is finding those areas that no, they really are making an improvement in the experience that we are going through or the information we're seeking. And so I really love that of we as nurses also have to challenge our own thoughts and preconceived notions about good versus bad and really trying to find opportunities to give it a chance and implement it in ways that could really improve not only our workflows and our work-life balance, but also the care that we provide to our patients. So, Jen, what recommendations would you make for training or education that healthcare professionals need just to feel confident using AI tools in practice?
I would say healthcare professionals would benefit from foundational education in AI literacy. So that includes how the tools function, what are the limitations, how to interpret the outputs. I think the training should be very practical and workflow based, focusing on we used real clinical scenarios. And then to maintain a competency as the tool changes, we should do a lot of just in time education on the new changes or the tools. And I think that would help the healthcare professionals definitely feel a lot more confident in using the AI tools available.
I briefly remember the transition from paper charting to computer charting and what that transition was like and living in both worlds. And so I see a lot of similarities in the implementation of this technology into our practice and just being willing to embrace what comes next, but also being intentional about learning what these new systems can do and how they can influence our work. As you mentioned, there's a lot of information and training out there about AI in general, but it needs to be specific to the use case that nurses are seeing in their practice, because sometimes it just doesn't relate to how they're using it or how they're seeing it. So I think that as AI becomes more commonplace in clinical settings for nurses and how it impacts their workflow, more education will be available to help support that unique use for nurses.
I agree.
So we've discussed how AI in oncology is about nurses using it to enhance their practice and certainly not to replace them. Where do you see AI in oncology going from here? And do you think nurses will continue to use it moving forward?
AI and oncology, I think it's going to continue to advance in our predictive analytics, personal care planning, probably real-time decision support. I think we'll see a greater integration into symptom management, some early detection of complications, hopefully, and longitudinal care coordination across our settings. Nurses, I think, will continue to increasingly use AI to maybe anticipate patient needs and prioritize care. Supportive precision oncology approaches while still being that patient advocate, providing that education and safety. I think the role of the nurse won't diminish. Rather, it'll become more elevated and allowing them to practice to scope of practice.
Jen and Emily, thank you so much for joining us today on the podcast. As we reach the end of the episode, we'd like to run through a series of some quick fire questions just to kind of help summarize some of the great topics that we've covered today in this discussion. So to start that off, Jen, we know that AI itself has a risk of showing bias in the information it pulls in and provides to us. So how do we ensure that that bias that comes from AI and then sort of shared with healthcare workers, how do we ensure that that is minimized or identified as part of that review process that involves the clinician?
Minimizing it requires both, I think, the technological and human strategy. AI models must be trained on the diverse data sets, as we previously spoke about, and be audited on a regular basis for any disparities and provide recommendations or outcomes. I think also the workforce, the nurses and clinicians need to be trained on recognizing potential biases in both AI in the output and in their own decision making. Embedding equity focused review processes or multidisciplinary oversights will help ensure that AI supports disparities in oncology.
Emily, what are some common misconceptions you see about AI in healthcare?
I think the biggest one is that AI is going to replace people. That is absolutely not the intention of AI, nor do I think it's possible. We never want AI to diagnose a patient. The provider and a clinician will always be included in that conversation. I think that we should conceptualize AI as the tool that enables us to care for our patients in an improved way with better outcomes and enables us to do the things we've always known we've needed to do and wanted to do. So use the example in oncology, there's research from Ethan Bash dating back 10 years ago that shows that regular collection of ePros improves patient outcomes. And yet we are not as a standard collecting ePros in practice across oncology or in healthcare because there are so many burdens and barriers to effectively and efficiently collecting those ePros and then doing something with them. And I think AI has the ability and the capability for us to quickly implement something like ePros without that huge administrative burden to better monitor our patients at home and reduce that gap between what happens at home and when a patient comes in and when they get their support so that we can actually realize an improvement in outcome that we know is possible through the research, but have never been able to implement. When I think about that, it's really, really exciting and not something that we should shy away from.
That's a great example. Jen, what's something about this topic that's not often discussed, but you wish people knew more about?
I would say AI is only as effective as how well you integrate it into your real world practice. Poor implementation tools can increase burden rather than reduce it, which Emily was just referring to. We spent a lot of time up front trying to get it right before implementation. Engaging our frontline nurses in the design and testing is really critical to ensuring that AI is practical, efficient, and truly supportive of clinical care. And I think who better than to give us the feedback or than the ones that are closest to the work. It is a lot of work up front to get it right on the back end, but it is well worth it.
Are there any specific education resources or other training resources, things that either healthcare professionals or even patients can seek out if they want to learn more about AI in healthcare?
I would say for oncology nurses, it's just continuing with that AI literacy, training tools, health technology, anything they can learn about data interpretation, and then the clinical decision support tools that are available. Education should emphasize the ethical and regulatory considerations for sure, along with bias recognition. And then I think it's really important the interdisciplinary collaboration with your informatics and data science teams is very essential to support an implementation and evaluation of AI practices. And then, of course, having that true competency, ongoing monitoring and quality improvement with the change management, updating in real time, and trying to think of ways to be innovative in the adoption process is really critical to continue to sustain the workforce readiness.
I think one of the challenges in the AI space right now is it is rapidly changing. AI is basically my job, and I feel behind on a daily basis. I was in a meeting yesterday and someone mentioned this entire new agent strategy that Google is deploying. We have to think differently about how we educate ourselves in the healthcare setting that is outside of our very traditional, very slow moving education processes that we have followed in the past. So I have found that the best courses are actually the free online courses that you can get that are from different vendors, or even just playing with and using the open source tools that come out in the AI space can be extremely helpful in thinking about and how you apply that in your work. And just know that you will always be behind in this space.
That is somehow very reassuring to hear you say, because I think that is something that is so challenging, is just how quickly it's moving and changing. And just when you think you figure out the latest update that came with your agent of choice, then there's a new feature and a new function. And so it can feel overwhelming that you're kind of always sort of just barely treading water. But there's reassurance to know that we're all in that same space right now. And so I appreciate those recommendations on seeking out those opportunities wherever they may be, and just trying to build that awareness, that confidence, that literacy in what these tools are, because ultimately we need to be able to share that information and that education with our patients when it comes to the tools that they are encountering as part of their healthcare experience. So Jen and Emily, thank you so much for joining us today on the podcast. Really, obviously, a very cutting edge topic, and hearing your experiences of using this technology and implementing it with your nurses in practice has really been eye-opening for me. So thank you again for joining us. Do you have any final comments to share with our listeners? Jen, we'll start with you.
I would say AI represents a meaningful opportunity to strengthen oncology nursing practice, as we've said, by reducing burden and enhancing the clinical insight. It needs to be a very thoughtful implementation. We talked about having strong governance and just continued investment in the nursing workforce. I want to reinforce oncology care remains deeply human, and AI should only be viewed as a tool that enables the nurses to do what they do best, which I feel is deliver that safe, compassionate, and high quality specialized care to our most vulnerable patients.
I would add that given how rapidly things are changing, I wouldn't get, as you're looking in this space, I wouldn't get too committed to a single tool or a single answer, and just be willing to be agile in how you think about how AI can be applied, but doing it with caution and understanding that there's a lot of danger in just implementing an AI tool without the proper thoughtfulness, without the right vetting, and without thinking about both safety and equity really strongly when implementing. And so it kind of feels like right now the industry is like a racehorse to figure out which tools are going to come to the top and be the industry standards for how we deliver care. But that speed and quick innovation cannot come at the cost of safety or equity for our patients. And so it's definitely a balance act between those two.
Absolutely. Very well said. Well, thank you again both for joining us today.
Thank you.
Thank you.
Thank you for listening to the ONS Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.